So as I told you, this is the only textbooks I prefer to the student to finish. There are two reasons. There are so many books in the market. If you run on behind of them, you will not finish each and every books. But just fix your mind and target these books and finish from beginning to ending. So it does not mean that if you are so good in pharmacology but so bad in psychiatry, you can make your license. No, there are 8 sections in NCLEX board. You have to pass in each and every 8 section. So when you pass each and every section, you will able to get your license. So this book can help you to give you some or very strong basic foundation. And as I told you, better to follow the edition, the most updated edition. 7, 8, 9 does not matter. The information inside the book is same. Because of their business, every time they change their edition. When I sit for my exam, I read this book. Okay, so here now I'm just have a short view. Okay, so in this book here, you can see a sticker number. Okay, here pin code. By using this pin, you has to go this link. Okay, it is called evolve. So when you click in this link, a new page will come, and this is called evolve. You see this book, you has to, this is the new edition, is the 801. Okay, the $68 you can buy from Amazon. Okay, so here I said when you open this book, you are able to get the PIN number, then you have to sign here, or you have to create a account, okay? Or if you have, you can use your email address and password, then you can open. So when you open your account, like here we are RN, so you can see 4,000 question, 4,000 question from evolve. So when you have it account, you can go to the left side in the bottom. It's called exam review. Exam review. So just click over there, then exam review open. So this book come, you have to go continue. Now you can see the 3 section, step 1, step 2, and step 3. In the step section 1, study mode, exam mode. First of all, go in the study mode. Just click on the study mode. When you click up there, the step 2, select the categories. You have to go to the content area, then subcategories, section 3. In the subcategories, there are, I said, the major 8 section for the NCLEX board. You have to know. So like pharmacology, very important. You have to pass individually. The pharmacology, not so hard, is really, really, really easy, but you have to know what you should know. The problem students feel so hard, then they avoid it. They feel it is a problem. But if you have any problem, you have to face it and you will find the solution. So problem is always the new opportunities for you. But same time I said, if you miss any one of my class, I have the system to record it. After my class, you have to text me. Unfortunately, I miss your class. Please send me the record. I will send it to you. Especially also, I want to mention in my school, on behalf of my school, like last month, I had one group. I finished the pharmacology from beginning to ending. It is not that too much. I have the recording. I only mentioning, like example, the steroid. What you has to know about the steroid? Which three drugs name? What are the side effect and what NCLEX asks from you? That as an RN, you should know for the patient. Same as the pediatrics. Here I want to mention, if you have very good sense or knowledge about the adult health or MedSurg, other name of adult health is a medical surgical, right? MedSurg, shortly say. If you have very good knowledge, then pediatrics will not a problem. But definitely pediatrics has some particular question, but very few, super short, okay? Like immunization, you have to know. Like infection, you have to know, right? So same as mental health, psychiatry, mental health. So mental health, again I say, you do not need too much deep depth of from the mental health. What you have to know, very superficial and very normal. So here again, the mental health, here very superficial and gross information you have to know. Maternity and child care, very important, you should know. Then go for adult health, the biggest one. Most of the question come from the adult health. You must know, and we have give you more time for this one, adult health. Something I want to mention here, usually the pharmacology, sorry, the fundamental of nursing, they should like here, fundamental of nursing skill. But from my experience, I want to say, actually all of this is fundamental of nursing. Critical care, developmental stage, fundamental skill, leadership and management. 1, 2, 3, 4, all included is fundamental of nursing. The student, especially the foreign doctor or foreign RN, did not pass the NCLEX board in the first steps, especially the doctor. The reason, they know everything. This is the problem. I respect them, but every exam has its own style. Every exam has some pattern. And every exam is a different area where frequently question repeat. The student is fail because of weakness in fundamental of nursing. Like you are so good in adult health, you are so good in maternity, psychiatry, mental health, you know that. Pharmacology, you are talented, but you have weak in the fundamental of nursing, the chance you will miss. The fundamental of nursing help you to understand the basic and your grounded question. If you miss it, your score will go down. Okay, so our most priority, do not miss any important question from here. So now, like adult health, I'm showing. So you do not click. You can see the square boxes, big box. I like to say, do not need to click there. The small arrow or triangle, small before, you have to click up there. When you click there, again comes subcategory and system by system, like cardiovascular, then ER, endocrine, eye, gastro, hematology, immune, intragumentary, musculoskeletal, neurology, oncology, renal, reproductive, and respiratory. This is the basic system in human being you must know, right? It is adult health or mental health. So first one, the biggest, the cardiovascular, right? The chapter where discuss about the heart and great vessels. Endocrine, it's the special system, some gland secret some hormone, and the hormone work in the different target cell and continue their function. Endocrine system always control and coordinate with nervous system. Like then go gastro, I mean GIT, we eat and digest system. Hematology means blood. Then immune, so when an infection attack you, your body try to defense, and this defense system is called immune system. Intragumentary means your skin protect your body, and there's so many disease is reflects on the skin. So you have to know what are the underlying cause of the skin disease. Then musculoskeletal, muscle with bones. Neurology means the nervous system, your brain, spinal cord, sympathetic, parasympathetic system including here. Oncology means the cancer, right? Malignancy. So this is the branches of the medical science where exploring or details discuss about the cancer or malignancy or neoplasia. There are two types of cancer. One is the benign, other is the malignant. Benign is innocent. Both are bad, but relatively better is the benign. It's 100% curable if you diagnosed at the beginning. But malignant is a very aggressive, right? So we discuss in oncology. Kidney or urinary work together. Your kidney and urinary system work together, right? It's called renal and urinary system here. So here, then go for reproductive, male and female different reproductive system, right? Very respective system, I said, because this is the system continue the generation to generation in the world. And I said we has to know very few for NCLEX board, right? And also the respiratory system. After the cardio, respiratory is the super important for NCLEX board. NCLEX board also frequently asks question from endocrine. So if when we go in endocrine system, I will show you actually what area frequently asks in NCLEX. Like when we work together, if I work with you, endocrine, we are so many faculties, every faculty is so good, so good. So they try for you, okay? And also we like to maintain the quality, okay, when we go to work with someone. So anyway, I said when you work endocrine, like frequently question come, hyperthyroidism, hypothyroidism, Cushing syndrome, Addison disease, right? Pheochromocytoma, like this. So there are 4 to 6 topic or keyword. If you know, you can make it. Thousand students are complete the program, but it is not true every student pass. Some pass because they know how to smartly work. So a student work from beginning to ending, they will not pass because they does not know how to work. So it is not that you all the time you have to study. No, you study, but you have to go forward very smartly, right? So I said every system by system, we will tell you, share with you what you have to know, but keep in mind, NCLEX or RN is a very prestigious position, a superior position in the hospital, in US health system. Very paid, very well paid job. But this exam, if you want to get your position up, definitely you have to work more. Same time, I'm saying NCLEX board question is not so easy because when you go in the Pearson, you have to answer through the computer and you have to fight with computer system. It does not mean there's some fixed question they gave you and you will pass. Not fixed. And NCLEX is hard because computer give you the new question to see your previous answer, right or wrong, right? So I said, in that point of view, it is not easy, but on the other hand, it is super easy because NCLEX board frequently asking the question, they repeat the question. Like 2 months ago, what type of question came, same time, same question, they repeat in the next exam. So from your school, the instructor can help you to identify which area basically you need, right? So also keep in mind, you join in the school, right? So there are 2 focus. One, when you come in the school, you started the program. After end of this program, what you are going to achieve? You are going to achieve the program complete certificate or certification, right? One achievement. Second achievement, if you study, you has to sit for board exam and clicks when you have the RN license. So both you have to have. If you want directly sit for the exam, you will not, right? A school will send your name will be there, then you have to sit. So basically when you work with us, you have to complete all of the PowerPoint and assignment. And what is assignment? I told you before. Assignment not only mean you have to write an essay and submit it, or you have to write something new for the journal or publication. Assignment means US education system. If you participate in any kind of discussion, like you are participating in the class, I'm going to take your percentage. It is also you have done one kind of assignment. In the Google Classroom, there's some videos. You have to listen. You have done some assignment. When in the Google Classroom, I will show you after a few minutes, the exam link there. You finish the exam, quiz, assignment, right? We also put some articles, some PowerPoint. When you go through the PowerPoint, you have done the assignment. And same time, I want to share with you or just recap it. If you do not go inside the Google Classroom and not listen the videos, it does not mean my school will not notify you. Yes, we can catch you. We will show you that this student how much time spent in Google Classroom. Everything will be recorded, right? So this is the adult health. You have to go. So other faculty maybe work with you, or you also can work with me. But when the faculty who work with you right now, just continue with him or her. All of us actually same. We work as a team, basically. So now go in the fundamental of nursing. What is the my subject on Monday? I'm coming another answer. I know what question came in your mind, but give me time. So I said the fundamental of nursing. This is the only one I can't shrink, but all of this is fundamental. Leadership, fundamental skill, development, and critical care. And I have the PowerPoint. I will email you every time. Like after finish 2 days, at tonight, you will get all of the PowerPoint. Or after finish my morning class, you will get it. All PowerPoint, I said. So here, right? Now question, most frequently asking question, this one. How long this fundamental of nursing lecture or classes? Answer is 6 weeks. Answer is the 6 weeks. Now, another question come. The student who joined today, they has to finish after 6 weeks. So Monday per weeks. After 6 weeks, you are able to claim for the 3 credits, okay, hour. Definitely by the time we will send you some assignment, quiz, you have to finish, you have to participate in my class. The student who joined with me today, I said after 6 weeks, they can say, yes, I have done. But the student who finished, like last week, they has to go after 5 days, 5 weeks. The student already have done the 4 weeks, they has to go for 3 weeks. So it is the actually the circling. So like I'm going to the subject, then second class, third, and after the 6th class, I'm back to the first class. So it is the circling. So student come after 6 weeks, they can say, yes, I have done, I have to go for other subject, or it is that I have done the fundamental of nursing credit hours. So 6 weeks, 6 weeks means it is actually 4 weeks a month, you know that, right? So this one, if you have any question, definitely you are able to ask me. And now I said, now go for the quiz from here. And up to when you go and finish the study question from here, right? I am going to show you one question. So yeah.
Oh, okay, let me show you something.
I do remember.
Okay, so as an example, the diagnostic tools I said, show you. So you have to begin like this. You have to read the question. Like a client is being prepared for a thoracentesis. This is the system to withdraw the water from lungs, right? So the nurse should assist the client to which position for position. So when we go through the system, I will explain what are the thoracentesis. It is not the time to go right now, but I'm saying when you go through, read the question very carefully, right? So when you read the question, thoracentesis, this is the key word, right? So thoracentesis is a procedure by which collect the fluid from lungs or collect the air from lungs, right? So this procedure, patient has to have a special position, right? Either left lateral, or they has to sit in the edge of the bed, hold their hand over the pillow on the table, right? So it is like I do not know the answer from here. At least I said prone position. We'll explain everything in my real class. At least is not the position, which is not an answer. Prone position means when the patient is lying on their abdomen, not a position, right? So like Sims position, no, Sims position usually the position we has to check for any rectum exam or perineal exam, perineum, or if you put this enema, that times the Sims position. Now lying on the bed on affected side or unaffected, maybe one or two, right? Is less, but I'm not sure which one, but not a problem. Not a problem, I said. So basically, we has to go through, like I said, one or two, but you do not know the answer. You do something wrong, like you can put the 4. I said your answer is 1 or 2, but I say a student knew, he or she do not know what is the answer, like put the number 4, no problem, just submit it. Then you see you are wrong, right? Then go from the rationale and read it. So I want to say this is the way to learn. A patient who have to go for the procedure thoracentesis, they have a special sitting or lying posture they has to follow during thoracentesis, and this is the lying on the bed on unaffected, right? So this is the information you learn and you has to write on the notebook. Don't go, okay, thoracentesis answer 2. Another question answer 3. Do not. Then go for the rationale. The facilitate remove of the fluid from the chest. This is the thoracentesis, because NCLEX board will not ask you the question, what is thoracentesis? They will not. But you have to know to make it easy. So the client positioned sitting at the edge of the bed, leaning over the bedside tap. This is the another position basically. Most of the 99% patient follow this posture. But the second option, they also can lie down on the bed, but in unaffected side. So this is the keyword you should know. So this is the unaffected side they has to lie. If patient a fluid or pleural effusion on the left side, they has to lie down on right side, unaffected. You should remember. So you do not get the correct answer, but you learn it. You does not miss anything. You achieve it. A new information you go. Then you have to go for the second, right? I'm talking about this is the way you has to go through. And also it is very important, super important, if you really want to pass the NCLEX board, if you really want, I said, you have to do every day 50 question, 50 every day. I don't want to hear you are so busy or you do not get time today. 50 questions. Suppose you are super duper busy. You do not have any time for inspiration and expiration. No problem. Do not need to do it. Just finish the 50 question first. Okay. So you dream should like this. Because of your dream, you do not lying down on the bed. When time come at the 5 a.m., you got up because of your dream. Or every day you got to the sleep 10 a.m., but you know now you go for 1 a.m. So 10 p.m. or 1 a.m. I said. So this is the dream. The dream should be the dream not to give you time to fall the sleep or spoil your time. How many times you go in the Facebook or social media, and how many times you go in the evolve question bank to practice question. So how you can claim for the licensing? Your friend passed, but you are not. But did you think how many times you use your Facebook? You click the Facebooking or social media, you giving the money to a rich company, and they are getting more rich and rich, and you going to poor, but you do not know that. So please think what you are doing. Okay. So here important thing, definitely you have to have the proper guideline or destination, what I should do, what I want. And don't think about you are not eligible, your friend eligible, you are not, or you are so busy, you are not enough time for that. No. If you really want, there are no excuse. No excuse. Okay? If you really want it. But only one word you have to know, just desire. I want my license. The student who really know how to want, they make it. But the student who do not know even to want, they do not make it. And all the time you are using social media and sit for the exam, you are not pass. Then you say, oh God, you are unfair. No, because just ask you how many times you uh, spend for the study. And other things is God help them who help themselves first. Even I can say, tell you, in my exam, when I see it my preparation was so bad. So bad means super bad. I'm doctor, but it does not matter who was what I am or what is my credentiality. Exam is exam. And I said uh, before exam, my preparation was not good. I did not finish my preparation even I do not, you trust me, I did not finish it. But only one point is every day I try. Every day I see it to solve question. Okay. And definitely this 4,000 question is the most important and help you to give you the your base or basement, basic. And when you have it and you complete it, then we will provide you two more question bank. One is called Lipin code. Lipin code only 1,000 question. And also the prioritization book. Prioritization is 1,200 question. The Lipin code, I have this book. If you need, I can email you now, but you have to finish the evolve question first. When you have done, and our school or we will provide you the Lipin code 1,000 question. Lipin code, this book, best resources after the sender question bank. This book can help you to understand some medical science because of the picture. Picture can talk. Okay, if you open that book, you can see this. Also, the other field student always hate, this is the select all category question. Select all. Student has a so many objection about the select all type, like select all type, right? Select all. But Lipin code books, all of the questions is select all categories, right? So when you go through the system, you learn. Another type of question is called prioritization. So like there are 4 or 5 patients and you are only one RN working with them, which patient is most priority? You have to go first to check. Because of your little bit help, you can save their life. Like a patient has a respiratory obstruction or aspiration, if you remove the uh, obstructive cause or remove the secretion, patient can continue the respiration, means you save the life within a time. A patient is saturation of oxygen less than 93%. You give them oxygen marks, you just put the oxymetry machine in the tip of the finger, you can see the reading is 91%. Immediately you give oxygen, patient is survived. It is not so hard job, but if you neglect them, your patient will expire, right? So in the hospital, basically when we work, we categorized by we categorized by we categorized by red, green, yellow, different color, right? Which patient you has to see first and who next. Some of the patient, okay, important, but if they wait for 1 hour, they will not die. So this is called prioritization of question, prioritization. So also here I said, it is not so easy to categorize who is come first. So this book can help you to answering the prioritization. So select all category question you help by Lipin code box, and prioritization question help the book name is called prioritization book, right? I have both of these. If you any student have finished this sender question first, all of them, I will provide you the soft copy by email. Okay, so this is done for the question portion. Now I'm just going to show you something more, because today or tomorrow this question also will come. Is called exit exam. What is the exit exam? So when student has to finish the all of the assignment, PowerPoint, everyday classes by the Zoom, and when student definitely complete their tuition also, we give them one final exam, and this is called exit exam. So exit exam, how you have to go and sit? Definitely for the exit exam, you has to come in the school. So from here, assessment, you see the pre-test, post-test. So we has to give them the from here 75 question from Evolve in exit exam. So the student who get 75% from this exam, we allow them for the board. Now you have to make, you should ask me, oh, it is so easy. Total question is here is 4,000. If the student, we gave them 75 randomly from the 4,000, if the student pass from here more than 75%, we do not have any problem. But it is the marker for you. That student finished 75. The student who pass exit exam more than 75, they also make their NCLEX board exam. So after 75% from here, we give you Lipin code and prioritization 1,000 question, and you sit for NCLEX board, right? So I said this is the 75%, 75 question come from total 4,000 question from here, right? So it does not mean that this 75 already you know. Yeah, you know, but this 75 must from 4,000. So you have to have the very clear concept from 4,000 question. When you have it, you can make it. Okay. So our student all the times make this one. And now I'm show you the materials what we use for the fundamental of nursing. So these materials is called, we put everything in the Google Classroom. So how we have to go in the Google Classroom? there are two ways you has to go in the Google Classroom. Just you have to type the Google Classroom directly, or if you have Gmail account, you has to click up there. When you click in your Gmail account, you is working. So when you have Gmail account, you has get on the top right Google Apps. You see some dotted area. You has to click over there. When you click, all apps come. Then go scroll down, and here is showing Google Classroom. You has to click up there. When you click, and if you are our student in our registration system, right, you are able to use all of the access from here. As an example, I want to show you the Endocrine, right? Or we can show another one is I'm showing like skill or online lab. So all like example here. So in here, every PowerPoint or videos related for the exam, everything is there. This is the assignment. When you listening these videos, mean so here I said go in the Google Classroom, the respiratory, it is a procedure, and also the materials is there. So like if I go here, this is the book, right? It is the materials I use for you. So this is called Fundamental of Nursing. If you click there, this is the book. It's called PDF version. You can download from Google Classroom. You can download. Same thing, same on the same time, I want to tell some of the students are not too much good in the computer. Sometimes it is difficult for them. If you text me, I will email the PDF. Okay, this is the fundamental of nursing care called concept and right connection, concept and skill. This is the book we use. Our PowerPoint, what I'm going to share with you, the ideas on base of these books. Okay, another one we use, this one is here, comprehensive review that I show you today morning, and click RN Center comprehensive review. This one. Some of the students like to follow both one, but I want to say if I like to welcome if you are able to finish both, but at least you have to read this one. Okay, so when you have these two books, and here another link is called the Evolve. So also it is resources, classroom resources, right? So if you click here, directly you will be connected in the Evolve question. So here